So you're able to see that easily. Well, so now like we were on the tractor nerve, right? Till here we studied. Cool. Now today's thing is like I just want to check it with this. Yeah, cool. So I will be adding something with this. Now there is something called pathway, isn't it? Pathway. What is pathway? Anyone can say pathway? It is the nerve impulse. Tell me, in and out of brain, basically. Nerve impulse pathway. Nerve impulse, how it needs a pathway to travel, right? Just to traverse and travel, it requires a pathway. So pathway is this. Every one of you know. There is some ascending tract, descending tract, all of you know. Last time I think we discussed also. Then we discussed about commissure, right? Commissural fiber. All of you remember? If I ask, like somebody actually gave me example also for corpus callosum, I understand that's also one of the like commissural fiber, and very very important commissural fiber. So it's a thick bundle of fibers. It actually connects both hemisphere, right? Same part of the both hemisphere, same part of the both hemisphere, that is called the commissural fibers, right? Then we something we discussed about even the association fibers, isn't it? Association fibers. So association fiber is what, which actually does for AP or PA, anteriorly, and then anterior posteriorly it connects the fiber, right? Then there is something we actually discussed about, sorry, yeah, D, just 1 minute. We discussed about decussation, right? Anybody remember what is that decussation? Like, it is a crossing of fibers, crossing of fibers that takes place which part of the brain? Brain stem, right? That's where it takes place. Okay, we discussed about reticular formation as well, where the gray fibers actually goes to the different, like a different site, and then it actually suppose from the spinal cord is started, and then at brainstem level it will cross and it will go to the different site, right? Again, the another fiber, suppose it is coming from top of the brain, and then it will cross at the brainstem and it will come to the periphery, right? This is how, either ascending or descending, anything. But this is the area where actually the brain stem, where actually the decussation happens, that means the crossing happens. Okay, and because of this you will have a lot of gray parts like this, okay, inside the white matter. So it will look like a reticular structure, that is called the reticular formation. Okay, this is how it is. I mean, it's not something what you should be thinking that decussation is just a word for that. Okay, then we discussed about the reticular formation and anything reticular formation. Another 2 3 classes for this basic. I'll not take much because I have told you you can go to my YouTube channel later and you can see all the basic structures. I have no issues. Okay, well, and after that there is something called fasciculus. This I have added today. Fasciculus. Fasciculi. You remember fasciculus? What is fasciculus? Anybody can answer me? Fasciculus or peduncle, right? Anybody can answer anything. You could answer anything. I have no issues. Hmm? You could answer, no problem. One minute, I'll come back. Yeah, so this is how it worked. Like you could tell me. Sorry, sorry. Yeah, understood. So now tell me, fasciculus. Yeah, I have to ask you a question, not me. I have to answer. Yeah. So fasciculus is what? Like, it's a thick bundle. It's a thick bundle where actually which actually connects the different parts of the brain, and it gives the support to the brain. Okay, it gives support to the brain. So it's something like like okay, fine. Anyone can name any fasciculus or peduncle, anything? If you can name, I'll be very happy if you say me. Yeah, anything else? You're right, go ahead. It is in close proximity to everything. Okay, fine. Let us see some of the peduncles, okay, which is very very important for you guys to remember. Actually, okay, suppose this is our famous cerebral cortex. Okay, to cerebral cortex, and it starts somewhere from the what's called as midbrain. Okay, I'm coming on the structure of the brain today, so schematic structures we'll see so that you don't forget it. So there is something which connects to this thick fiber, cerebral cortex. Okay, so this is called what is cerebral peduncle. Correct? Correct me if I'm wrong. No one? Correct me. You guys are a student, you study every day. Then with our this structure called cerebellum. Hope I'm not boring you guys. So cerebellum, this is a dry subject, neurology, always remember. So you have to be, I try to make it little easy for you, but it's actually the dry subject. So cerebral, then there are three, you should remember this: superior, middle, and inferior cerebellar peduncle. These all are cerebellar peduncle. I don't want to go very deep anatomy, otherwise I need minimum 60 to 70 or to 100 hours also up to anatomy and physiology if I go with. So I just go, like I touch the topic and come back, and you should answer. Okay, you should answer. And if you don't know, you read an answer. But these topics are very very important. They ask you in the viva sometimes, and then you get confused. Okay, fine. Fasciculus. And after that, one more term is important, is what lemniscus. How many of you know about lemniscus? Have you heard of lemniscus? It's a ribbon kind of, ribbon kind of band of nerves. So lemniscus. Cool. Lemniscus. So you should remember, actually, lemniscus are something. Suppose this was the like. Suppose this is the ascending tract. Okay, right ascending tract from the brain stem and go up to the cortex. Okay, so these all are the band called lemniscus. Okay, so you should remember minimum four lemniscus: medial, lateral, superior, and trigeminal. Okay, these lemniscus you should remember. See, I'm just touching and coming out. Reason is what? Reason is some very very simple. Reason is these things, it should be in your mind when you go for the viva, at least for viva. Okay, and in coming, I can't say slide because I don't teach on slides. I have slides, but I don't want to give you all those slides and mug up like other students. No, you should understand this concept. Okay, once you understand the concept, you can do anything. Good. So, in my another this one, if I come, then you will understand why it is so important. So, let us talk about now myelinated and demyelinated. Before that, I will just change it. Yeah, definitions and terminologies. Okay, cool. So another commandments what we are going to study today is myelination versus demyelination. Very, very important topic. Myelination versus demyelination. Did anybody study about myelination, by the way? Anyone? Anyone? If you have studied myelination versus demyelination, little bit also if you have read. Anyway, I'm going to tell you. Today, we are going to see something very interesting, and many of the time we miss it. So, just see that myelination concept. Okay, how it works for you. See, I'm drawing a schematic diagram again for the brain, just for making you understand. This is the hind brain, and then here is our, suppose cerebellum is there, then it will go down, then it is pons, midbrain, and medulla. Okay, this is our central nervous system, and this is where it descends down as a spinal cord. Now I'm getting a cross section of spinal cord. Cool. I am getting a cross section of spinal cord. Let me make it. Yeah. So every one of you know this is the posterior horn, lateral horn, anterior horn, and then the symmetry in this side also coming like this. This is the spinal canal. Don't judge me with my picture because I may be a little bad in the picture, but it is idea to show you the what I want to show you why basics are too important. Okay, this is what is called, anyone? Today, I think one more boy had joined first time. Earlier, he wasn't there. I think earlier class, if I remember. I can't see you guys' face, but I'm just telling you. So when I said the recording, just go through that. So this is the gray matter, right? But in CNS, where is the gray matter? Anyone? Gray matter is on the territory, periphery, right? It's in periphery, cerebral cortex. Everyone, you remember? And then this is the cerebellar cortex, right? This is where we were talking. Now see, dear friend, just see this. This is brain. Brain. I'm also. This is spinal cord. Cross section I have taken. CS cross section. Just to make you understand, here the gray matter is in the periphery, but here the gray matter is in the center. Right, so this is the white matter, this is the white matter, everything. So basically what does it mean? This gray matter goes start and then at level of brain stem, you remember, like there is a reticular formation and they change. So this is how the first difference is. Okay, so myelination means fiber will look white, it has proper myelin sheath, right, which helps it in the faster conduction. True, it helps in faster conduction. All of you know this. So if I show you the very basic diagram, like this, and then there is a axon sheath going like this is the node of Ranvier, and this is the cell body, what we say as a cytosol. I mean, this is the cell body. Okay, so this part is remain normally white, this is myelinated. So what is the beauty of myelination? Nerve conduction happens faster. Now tell me one thing. Suppose suppose it happens so that you know uh, can you name one disease which where the demyelination happens more? Any one of you, please? Anyone? If you don't know, anyway, I'll be coming very detailed in those diseases. But there is a disease called multiple sclerosis. Okay, but I want my student to learn these diseases right from the l- days of basics. Multiple sclerosis. Have you heard of this disease? Any one of you? No? No worries. Okay, well, good, nice. Have you seen the patient? Because my question will be this, because it's difficult to see the patient. If you want to see, you have to contact me. I'll show you. That's not a problem. I have seen lot many rare cases. So multiple sclerosis is, I would say, not easily seen case. But yeah, in southern, yeah, I have seen here in Bangalore. I have seen multiple times. I have seen, no doubt. So what happened in this case? Multiple sclerosis is all about demyelination in the nervous system, right? Nervous system. So suppose the MRI come, what it will show? This area, it will show demyelination, right? Demyelination का मतलब क्या है? Myelin sheaths will be hardly present. Cool. Why it is like this? You should understand. I'll open your, like, I'll get you remember all those things. I'll open your thought. This is the cell body, and this is the, I told you know that last time, like a rat. Okay, ये वाला part जो है ना, this is in the cortex, and the body is like this. Okay, just see that, right? So naturally, it is supposed to be the gray and it is supposed to be white. Why? Because there is a myelin sheath on top of this. Now there is a, as I said, there is a demyelination. So what will happen in demyelination? Myelin sheath will go away and it will appear little grayish, little different. Anyway, in MRI, if you see the MS disease MRI, if you see MRI, we say that uh, oligoclonal bands, IgG. Okay, oligoclonal bands. Okay, see oligoclonal bands in CNS and clarify. This is a demyelination of central nervous system. Cool. Okay, so अब ये बताइए, if you don't know where is the white matter, where is the gray matter, how will you be able to say this? You will not be able to say this because you'll get confused. You will definitely get confused, right? So the basics are important. So concept of myelination, I will not go into the chemistry of that you know better. Okay, and how the nerve conduction happen faster, as I told you, in month of, like, last week of April mostly, they are going to upload the video. You can always see neurophysiology video. You must see, in fact, I would say. Okay, so after coming out of all those things, uh, before touching the concept of, or let us touch the concept of, what we say, like how structurally and how functionally our units work. I mean to say, structurally, as you know, the nerve cells are there, which we can see structure, formation, and these things like this. There is a unipolar, there's a multipolar, there's a bipolar. A lot of these type of cells are there. Okay, and like this. Okay, so like this is the structure. Okay, well, we can see that, that's not a problem. But we have, what we have to study is the functional unit. Okay, so when we say the functional unit, which we can't see, basically we can't see how the function is happening, but we have to understand the functional stuff. How? This is our spinal cord cross section. Cool. And this is how is, okay, this is the central canal. Every one of you agree, central canal. This is, what is this called? Anybody? This particular depression, what is this called? Anyone? No problem. See, even though you say wrong, don't fear that what sir will say. Sir will say nothing. I was also like you. Maybe I was worse than you. So don't worry about it. Just tell me whatever you know. This is anterior median fissure. Cool? Anterior median fissure. Okay. This is what is called as central canal. This particular structure. Okay. And this is, these are the horns of the spinal cord, right? I mean the gray matter. So how what is this? This is posterior horn. This is lateral horn, and this is anterior horn. Cool. Now after this, we have to understand the functional unit, how it works. Cool. So from the no, before that I'll make a stimulus. Okay, fine. Suppose there is a stimulus could be anything. Suppose a mosquito bites, or there is a, you have touched the candle, hot candle, or you have touched the stove. Today you are making something, you are talking to your mummy, and then you forgot something, and then you touched, oh my god, it's hot. Okay, the stimulus. Well, so suppose stimulus comes from the sensory system, goes to where? Posterior horn, right? There are other structures also involved. I'll come on that. Just I'm telling you. Then what happened? Tell me what happened after that. The it has to come from where? Then you remove it. Okay, or you try to kill the mosquito, or you try to take it away, right? So what I mean to say, that stimulus through the sensory nerve, okay, it has coming like that. Okay, then after that motor response will go like this. Okay, so it is coming from the skin, and the muscle will be moved as a motor. So I mean to say, this let us take as a motor, this let us write as a sensory. Very simple concept. There is a dorsal root ganglion also in between, DRG. Okay, dorsal root ganglion. Again, ganglion has come. Why it is a ganglion? Because it is a part of peripheral nervous system. So simple. So this is called the functional unit, a reflex arc. Every one of you know this. I just made you revise this. Okay, very very simple. Okay, and if I come little deeper structure, little deeper part of this, I mean to say, I'll make it in a black only. Okay, so nervous system, you can control or you can't control. Based on our control, we have somatic, and then we have a autonomic. Autonomic, somatic and autonomic, these two. Now either somatic or autonomic. Somatic means something you can control, so here also it will be the motor or sensory, right? But in autonomic you will always have either sympathetic, parasympathetic, and one more thing is there, since you are a medical student, so enteric, right? If you want to know more about this, obviously these all will be available in the physiology video. Okay, and so there is something called mixed. Have you heard of mixed nerves? Definitely you would have. So that is a motor plus sensory, and it could have or could not have a autonomic nerve. Okay, so this is a simple theory I wanted to give you. Okay, it will help us to go for, to understand the basic organization of nervous system. Okay, so this was the part I wanted to tell you in the basics today. This is a part one now, don't think the class has gone off. Okay, and we will take a gap of 2 minutes Again, we will come on this, and then we will start our next part. Okay, that will have a like a basic structure of brain. How to draw, I will tell you in other class, how to draw the gyrus, sulcus and all. No, I'm not going that deep. I'm going like how you divide, like embryologically. We will go for embryology, because many of people, they get confused even in the viva question, so I don't want to take you chance for that. Embryology will go for very short. Okay, and then neuroembryology, and then schematic structure of the brain we will go